Wow. Question number one. Come on. There. Does type 1 diabetes stop someone having elective plastic surgery? So this person has inquired and wants to know if she can have surgery. She's got type 1 diabetes. So the answer to that is that diabetes is not, there are basically absolute and relative contraindications to surgery, and it is not an absolute contraindication to surgery. Because you can have surgery if you have type 1 diabetes. But there are potential problems in someone who has diabetes, mainly in the form of risk of infection. You have an increased risk of infection if you have diabetes. So the fact of the matter is, if you've got diabetes, you've got a higher risk of infection than someone who hasn't got diabetes. Infection is particularly important if someone's having breast or implants, really. But I suppose breast implants are the most common implants, but any sort of implants in plastic surgery or in any surgery. If you get an infection with an implant in, you have to remove the implant. So infection is something we really worry about, and we are very keen to minimize the risk of infection, particularly if you're having implants, but obviously you want to minimize the risk of infection if whatever surgery you're having. So the thing that I would say to the person is, first of all, is your diabetes optimized? So we would probably want to talk to the doctor who's looking after your diabetes to make sure that you're not in a period where if you're on insulin, which often type 1 diabetes people are, but if you're on insulin, but whichever type of diabetes you've got really, whether you're on insulin or however it's controlled, is that stable? Are you in a good place in terms of your diabetic control, in terms of your blood sugars? If they're stable, fine. If they're a bit up and down, if you're going through a funny time in your life, if your weight is changing and maybe your sugars are changing, then we would want things to be stabilized before having surgery. So the first thing is we want to get you as good as we can. And this is the same for any sorts of chronic illness, I suppose. If you are in a period where it's a bit up and down, then you'd want it to be stabilized before having elective planned surgery. So we would do this in liaison with the person who's looking after your diabetes, your endocrinologist or your GP or whoever it is, to make sure that things are okay. Number two, we would say to you, once we're happy that it's stabilized, I guess it depends on how bad your diabetes is, but I've done surgery on people who've had like constant infusion of insulin, a continuous infusion, so not even just insulin injections. So we have done surgery on people who have bad diabetes, but you have to have a discussion with that person to say, look, you've got an increased risk of infection, and whenever you are thinking of having surgery, you've got to weigh up the pros and the cons. And so infection is a con with anybody, but in someone with diabetes, it's bigger because you've got a higher risk of diabetes. So you've got to weigh up the pros and the cons. So the pros really are what you will benefit from having surgery. So only you know how heavy the pros are. So it will add weight to the cons because you've got a higher risk of infection than someone else who hasn't got diabetes. But your pro might be so high that that's okay. But if your pro is the same as someone else's pro, so if you want the surgery the same as someone else who hasn't got diabetes, and that other person is just a little bit, the balance is just tipped in favor of the pros, then for you, that extra weight on that con might tip the balance the other way and might say, you know what, I don't want to have surgery because, if I have an infection, I have to remove the implant, that's a nightmare, and I don't want to go through that. So it's just something to add into the mix, to add into the cons. As I say, it's not an absolute contraindication. Doesn't just because you've got diabetes type 1 or type 2 doesn't mean that you can't have surgery, but we want to make sure it's well controlled, and we'd add it into the mix in terms of the risk of infection, which would undoubtedly be higher in someone who has diabetes. Just put it in the mix. You're gone. I'm gone? Oh God, oh, you're back. Okay, flipping heck. Why wasn't your temperature okay? Have you been sick? No, my temperature, no, it was fine. It was 37.1. I was just messing with the temperature thing. You're back, don't touch. Say Siri, who is the fairest of them all. It's funny. Oh, mate, yeah. I'm gonna leave. I don't really use that. I'm not going to say the word because the phone will kick off again. Right, where good, good, right. So I think we nailed that one. Right, can I correct my surgery I had done a year and a half ago? I had implants. I woke up to a breast lift. Also, later found on the implants were tear-shaped, not round. The scarring is so bad, it looks like my nipples have been stretched. Also, I'm so scared to have surgery, but I can't let no one see my top half. So this patient has given photos, but the problem with the photos, I'm wondering if I can. They've got nipples on. So can I move it? If I can move this, because I don't want to get told off. Can I move the widget? I don't want to get told off from by Facebook um, by putting nipples on the screen. Sorry, so show item. Oh, I've got to be honest. I'm all over that. I've had enough time to prepare for this. I'm all over the place. I'm sorry. So I have got photos to show, but I'm a little bit cautious. What can I show that is okay to show? Maybe if I flash them up. No one on Facebook. I mean, it's the children. That's all right. I should put a warning. If there's children watching, can you ask them to turn away? I'll tell them when to turn away, and then they can turn back again. So while I'm doing that, which is something that's in hand currently in the background, because I'm just going to click some buttons. While I'm clicking the buttons, the two things about this. First of all, it sounds a bit odd. What was it? Something like I thought I was having implants and I had a lift. How can that happen? Does that sort of stuff happen? You thought you're having implants, you had a lift? Crazy. And there's two messages here. The first message is one person's good result is another person's bad result, and vice versa, because there is some issues with the scarring, which I hope to show you as soon as I get my technical team to get the picture up. But aside from the issues of the scarring, this patient's also unhappy with the shape of the implants because they're teardrop implants, and I think she feels that they should have been fuller. And this is why this sort of surgery is so subjective. A good result is so subjective because I've got to be honest, I think this result is a good result. Looking at it without even hearing anything from this patient, it's a good result. But she's obviously unhappy because she's sent me photos and isn't really unhappy with everything. So therefore, it's not a good result, is it, if she's unhappy? So it is so important to try and get your surgeon, for me giving you advice, get your surgeon to understand what your goals are. And as a surgeon, it's so important for us to get aligned with our expectations, with the patient's expectations, because if we don't deliver on what the patient thinks, they're not going to be happy. And that is so important in this line of work, more so than I can't get the photo up. Oh my god. It's okay. It's okay. It's fine, guys. Listen, I'm fine. Don't worry about me. I'm absolutely fine. All right. I've got a plan. So I'm just, I'm you wouldn't even know that there's something. If someone from the outside was watching this, they wouldn't even know that something bad's happening. So I'm just going to do something while you're waiting. So yes, you have to have your expectations aligned, because actually the result of the surgery is quite good, and but the patient's not happy because she wanted different implants. They've given her a lift and they've given her teardrop implants. I mean, goodness me, and she didn't want a lift and she wanted round implants. So that sounds insane to me, but I guess that's, I don't know. But so in terms of the surgery, yes, you've had teardrop implants. You could have rounder implants, which would be fuller, which sounds like what you want. So I always say the shape and the profile of the implant is really, really important. It's much more important than the size of the implant. Everyone talks about the size of the implant, but the shape is going to make you unhappy. The size is going to make you like, you know what, I wish I'd been a bit bigger. Not properly unhappy, just a bit like that. If the shape is wrong, you'll be properly unhappy. Oh God, it's too flat or too full. So the shape, guys, is more important than the size. Remember that. Shape is more important than size. I wouldn't say size is not important, but it is nowhere near as important as people think. Shape is more important than size. So while my other screen is loading up, oh yeah, the other thing was the scarring is bad. So the scarring is bad. So she's had a lift. I mean, what a nightmare! You weren't expecting a lift, and then you get bad scarring. So because the big thing about the lift is the scarring is on the front of the breast, the scarring is around the nipple. So that and the scarring has stretched a bit. So that is an issue. And the first thing, if someone has bad scarring after surgery, the first thing I'll say to them is how did, maybe not the first thing, but one of the things I'll say to them is, how did it heal? Did it all heal up okay? So if you say yes, it all healed up okay, to be honest with you, that makes me worried, because if it didn't heal up okay, if you had a bit of infection, if you had a bit of a delayed healing, which can happen, and that is the reason that you got bad stretch scarring, then that makes me think, well, hold on a minute. If I can do the surgery and maybe we're lucky and we don't get infection or delayed healing or problems, then the scarring can be good. If you didn't have problems with the healing, if it all healed up fine, and yet still your scarring is not very good, it's a bit stretched and it's not quite as good as we would like it to be, that makes me think, well, what am I going to do different? Why won't it just be as bad when I do it as when you had it last time? Because that's when we do surgery for scar revision. We've got to think, what can we do differently to what the guy before did? And as I say, if you have a reason for the stretched scarring, then fine, that might be a goer. But if you haven't got a reason for the stretched scarring, it does slightly ring alarm bells with me, and think, well, I would worry that if I did it, it came out just the same. Now, you might say, oh, you're a great surgeon, blah, blah, blah. Obviously, that's true. I think you and I both know that. But it doesn't matter how good a surgeon you are, we all have problems. I've got to be honest, full disclosure, we all have problems. Any surgeon who tells you they don't have problems is either not being honest with you or is not doing enough surgery. We all have problems. It's a bit like gambling. There are good gamblers and bad gamblers, and good gamblers can put the odds in their favor and will win more often than they lose. But still, they'll lose sometimes. Still you're going to lose sometimes. You cannot. It's horrible, because you want to win every time. You never want to lose. But it doesn't matter how good you are. There are always situations where the scarring wouldn't be as good as we want. There's always a risk of infection. There's always a risk of delayed wound healing, of basically an unsatisfactory result. So any surgeon get an unsatisfactory result. So someone coming for revision surgery after an unsatisfactory result, we've got to think, what can I do differently? So I've got to be honest, I would worry about revising these scars. They were a bit stretched. Actually, I don't know. Actually, yes, I have got an idea how I can show them to you. I'd be worried about revising these scars if there was no reason for the delayed wound healing in the first place, because I would worry that it might be the same outcome if I did it or anyone else did it. Now, if you're saying you don't like the implants and you want to have the implants changed, well, that maybe gives you another reason for surgery. But if we were just changing the implants, we wouldn't have to touch the scar around the areola, because it's the scar around the areola that's stretched. So it might be worth revising that scar around the areola to make it thinner. There'd always be a scar. That's the other thing you've got to realize. If you're having a scar revision, there's still going to be a scar. The aim is to make it slightly less stretched and a thinner scar, but there's always a risk it can go stretched again. I wish I hadn't said I've got a photo now. So maybe later on in the show, if any of these pages load up, is it me? I'm trying to load up. Is it my house? Is it the children all on their games all over the place? So yeah, so those are the two issues. I think the one issue is this. I think I've got to be honest. It's a good result, but you're not happy. So you could have a fuller implant. It would be a rounder look, and that might make you happy. But it's unfortunate that you weren't aligned with expectations preoperatively. And the secondly is the scarring, which, as I say, could be revised, but there's no guarantee that it would be a better scar than what you have now. Obviously, the aim is to make it better, but there's no guarantee of that. Did I get away with that? Don't worry about the photo pop it. Okay. Thank you. No, no. To be honest with you, I'll probably get kicked off Facebook anyway because it's got. I have to try and get the. Oh, here we go. I've put open Facebook. Does that know that I'm like this is going to go all funny now? Inbox. Anyway, okay. Let us go to the next question. Without further ado. Oh, here we go. They didn't heal. They kept opening a little bit in place. Right. Oh, right. Look at that. I've got a message during the. That's what we need. Good. Sorry. Let's go back to that last question. Where is it? So they didn't heal. Right. Okay. They kept up. They kept on opening up a bit in places. Well, that's good to know. So if they kept on opening up a bit in places, that is good to know because that means that maybe if they didn't heal, if they didn't open up in places, then it might be better scarring. So that is a potential for making things better, but only a potential. And I've got to be honest, I would be a bit reluctant to do further surgery, just purely for the scars. Implant, then that's a different story. That could be changed, the implant, if it was a bad or not a bad, the wrong implant choice. It's not a bad implant because it looks okay, but it's bad for you because you don't like it. And at the end of the day, you are the judge, jury, and executioner when it comes to judging the result. So thank you for that. Yeah, thank you. I'm going to give you a thumbs up. There you go. Sorry, what's going on here? Can the lady watching edit her picture and resend it to you? Just might be easier. You know what, Natalie? I don't think it'll be easy at all because I can't even get the picture up in an unedited way. But yeah, good thought. So life is to. Life's hard. Anyway, take my word for it. It's a good result, but the scar's a bit stretched. Yeah. Are you still doing? I do. Please don't be put off giving you photos. I say to them, show us photos, and I'd like to share photos. I've got to be honest with myself. I should have maybe put little smiley faces over the nipples and got it all prepared beforehand. Full, you know. I'll put my hands up. I'll put my hands up to that. Thank you. I did want more upper poleness. Wasn't really bothered about the size. Yeah, well, you see, it's upper pole fullness that she wanted, not the size. So I'm glad you weren't bothered about the size. The size is never, I would say, more important than the shape. And you wanted more upper pole fullness. And if you wanted more upper pole fullness, a teardrop implant wasn't really going to give that. The teardrop implant is going to give less upper pole fullness. You wanted a round implant. Tragedy. I'm sorry that you've not happy with the result. But I would warn you against having further surgery because you have got a good result, and a lift with implants is a big op. So if you're going to have things redone, you're going to go through another big op. So, but anyway, very, very good. Very, very good. Are you doing surgery at the moment? So we've had a few questions like this. And the other thing, actually, that's the next question. So I couldn't find any photos on your website of revision surgery. No, I haven't got much. So the problem with it, Natalie, it's hard to do photos of revision surgery. Oh, actually, maybe you mean exchange. There's exchange of implants, isn't there? I'm sure there's exchange of implants, not necessarily revision surgery. But revision surgery covers quite a spectrum. I suppose I could do a page called revision surgery, could I? But it covers quite a spectrum, and it's quite a heterogeneous group of individuals because there's all sorts of problems that you can be correcting: too high, too low, too wide, too big, too small, too round, too flat. All sorts. phone rings, it cuts my internet. So not revision. So not revision asymmetry surgery. Yeah. Have I got an asymmetry page? I've probably got an asymmetry page on the blog, Natalie. Probably, but I'll have a look for it. So, in answer to your question, there, are we doing surgery at the moment? Yeah, we've had quite a few questions about this, and now we are classed as I say we private practice in general is has been stopped, so it is um, less. So there's no private practice being done. So we are not doing any private practice surgery at the moment in terms of elective private practice, in terms of breast lifts, tummy tucks, nipples, revisions if someone's not happy with something, if they've got a doggy or what have you. The only surgery that is being done now, it is significantly less surgery is being done now in both the private and the NHS, and in fact there is no elective surgery being done anywhere, and basically private, the vast majority slash if not all private practice is all private practice is elective surgery. So elective surgery in the NHS and in the private sector, and the only surgery being done now is urgent or emergency surgery. So if you injure yourself, or if you have an appendicitis, that surgery will be done, or if you have a cancer or a time dependent urgent issue, a space occupying lesion that's getting bigger, something that's growing, that's causing a problem. Actually, I shouldn't have said that, because my next question, which comes on to my next question, but say I'm thinking more in your brain, in your skull, it could maybe not be a cancer, but if something's getting bigger and causing problems and this has to be done now, then that sort of surgery is being done. So the sort of surgery that I do in my private practice is very much elective planned surgery. So I'm not doing any private practice surgery at the moment. Or so in terms of the clinic, the Stiano clinic, I'm not doing any surgery. I am still doing virtual consultations with patients on a Wednesday and sometimes on a Friday too. So I am still doing some work in terms of, say to patients if they've got any problems, then they can always get in touch, and I'm still engaged with them and still around and still working. But in terms of the workings of the clinic, no, we are not doing surgery at the moment with COVID-19. Nobody is. The only surgery that is being done is cancer and emergency and urgent work. So no surgery is being done, and you will know when we know in terms of people going back to work. I suspect the first surgery that's going to start being done is going to be local anaesthetic work at the clinic, followed by general anaesthetic work at the hospitals, which will then obviously have a huge backlog which we'll have to get through. But we will double down, and I'm sure we will work double hard to get through that and to get all the cases done that we have postponed, and all the new cases that are inquiring now. So no, there is not much surgery being done at the moment, and it is all emergency and urgent work. So in answer to this question, having said things are enlarging, I was meant to have an appointment 2 weeks ago, and because of the coronavirus, it was cancelled, and my cyst is getting bigger on my face. Just wondering when I can get booked in for it, please. So yeah, I mean, unfortunately, if it's just gradually getting bigger, now when someone says their cyst is getting bigger, I do think, is it infected? Is that why it's getting bigger? So if it's red, angry, inflamed, you might need some antibiotics. So it might be worth calling your GP about that, because if it's infected, then you might need some antibiotics. And in fact, if it's infected, we wouldn't remove it now anyway. But if it's just sort of slowly getting bigger, and to be honest with you, cysts do tend can get bigger, but they're usually pretty slow to get bigger. But if it's just slowly getting bigger and you're worried that the scar is going to be bigger and it's a nuisance, then really there's nothing you or I can do. We can't do the surgery now. We can't see you unless the only patients we're seeing are, again, urgent cases. So we can't see you. We, you can talk to us, and you can, have a virtual consultation, and we'll support you as much as we can in a virtual way in terms of giving you help and advice. But if the overlying skin looks normal, if it's not infected, if it's not looking like it's causing a problem in terms of, well, obviously it is causing a problem because it's a big cyst on your face, but if it's not infected, basically, then no, we can't do it. So when can you get booked in? We'll let you know ASAP. Well, if you're our patient, we'll let you know ASAP. We've got a list of all the patients who are have been postponed and all the patients who have inquired for surgery. And you can rest assured we will work our socks off to get everyone through the clinic. There's 4 of us. There's 4 plastic surgeons at the clinic. We've got our own operating room. So for this sort of work, we can just work constantly in the operating room, and we can utilize that space. So that will, I would hope that we'd have that backlog cleared relatively quickly. And obviously we'll also be working on the other cases in the hospital. Oh, that's it. I'm out. I'm out. Oh, sorry. I'm out. Sorry about the problems early on. The screen said I muted it. I don't remember muting it, but who am I to argue? So I must have muted it. And thank you for the questions. There is still quick questions coming in, which is fantastic. Keep them coming in. If you've got any questions, type it now, and I will do my damnedest to answer it. Go on, dare you. Go on, type in a question. Still can't share my screen. Button here that says share screen. Nothing happens. Oh, hey ho. So get yourself hot chocolate. Okay. More of a statement than a question, Olivia, but I do like the sentiment, and I think I might just do that. And yeah, nice evening, isn't it? Nice evening, nice weather. Come on, guys, let's look on the bright side. Come on, let's look on the bright side. I suggest you all do likewise. Thank you all for coming. I want to thank each and every one of you for coming, and I will do my damnedest to be here at 7 o'clock with a working microphone, a working screen, pictures to show you. Honestly, next week it is going to be so much better. Tune in next week because I'm going to have it sorted. I'm going to have the screen sharing all over the place. I'm going to have the microphone so you can hear what I'm saying. All sorts going on. On that note, take care, everyone. Remember to search for the rainbows in the storm. Oh God, let's get that on the screen. Is that going on the screen? Look at that. Rainbow emojis. Oh, blimey. I wish I'd put something like that on. Wish I'd thought of that. Oh, sunny tomorrow. Always on the bright side. Take care. Stay safe. Yes, take care. Take care of yourselves. Don't go doing any crazy DIY because that's what you've got to stop doing in terms of the emergency work in the NHS. We've got to try and stop people from cutting their fingers, cutting their hands, because we don't want to be doing the emergency and elective work. And yes, we are all staying at home, aren't we? Are you not? Are you not staying at? Yes, I'm talking to you. On it. Just exercise. Remember the pharmacy and the super. Yes. I'm looking at you, honestly. Right. So just knock it on the head. Stay indoors. Come on, guys. We can do this. And It's an emoji fest. Angela, wouldn't it have been annoying if I'd gone off while you were typing all those emojis in? That's like that on the online chat on our website. You're typing in an answer and then they go offline and your message goes. Really annoying that. So yeah, okay. Carry on staying at home, guys, and I will see you same time, same place next Tuesday night. Facebook Live with for another Q&A, and that's been great. And thank you all for listening. I will see you next week.